Dr. Butterfield here. I want to make another video today. This one I want to talk about the standard of care. So this is the term that's used for kind of the mainstream medical model. They call it the standard of care. So this versus what I would call, I'm just going to call it the magic of care for right now. All right, and I'll go into what I mean by that. So standard of care means that they do all these studies and they land on what they think would be the best solution, the best care for, and it would be the best pharmaceutical or surgical care for everybody. Okay, this is what you see this symptom and this is what you do. You get these lab findings and this is what you do. And more, this standard of care is encroaching on all forms of medicine, including naturopathic medicine, chiropractic care. There's this standard of care. Now, I think that there is value in that, and I'm grateful that all those studies have been done. But you're losing the magic of care when you have take this approach that you are you're essentially memorizing everything and you're giving every single person the same thing. There's no individualization. There's no the term I'm using is magic. There's other terms that we use for that. In the original healer from my lineage was Franz Anton Mesmer. So he would use his hands to heal, and he called that magnetization because he talked about the true fact that our bodies are magnetic, and he would magnetize his patients. That's what he called it. But in many traditions, there is this very individualized medicine where the healer, the practitioner, is the medicine to a large extent. It's not this memorized, every patient gets the same thing. So in China, you have acupuncture and Chinese medicine. In India, you have Ayurvedic medicine. These are thousands of years old, and it really takes a lifetime to really master these forms of medicine. And I think there's a lot of value in them. They're Eastern traditions. I follow Western traditions, and a lot of people actually think that naturopathic is Eastern, and it's not. It's actually a Western tradition. Chiropractic is another example, and I've heard good chiropractors compare chiropractic to martial arts. Okay, so there's this element of mastery and of kind of stealing your mind. There's this focus and there's this feel to it. And I used to practice on the methods I use, which are some of the kinesiologic testing, so total biomodification and applied kinesiology I use in my practice. When I was in school, and I would treat all the other students, and we would practice on each other. And people would say, Brett, you go into the zone. You're like a different person when you're treating patients, when you're treating people. And you go into kind of this altered state where you're focused and you're in the zone, and you're in rapport with your patient, and kind of this intuition comes alive. And every patient, I mean, you can have 10 patients walk in with the same condition or symptoms, and they could all be treated differently. And this is really significant. I think that this is where the magic of medicine comes. If you're going, there's something we call green allopathy, where basically people are taking the standard of care approach and they're just using supplements or nutrition or herbs, and they're they're trying to force the body to do something, and there's no magnetization, there's no individualization, there's no magic there. And so I would recommend to you not to go to a practitioner who has a rote protocol. So I've seen this even with, you know, a lot of, and I don't want to name names, but practitioners and so forth. They've got like this system, and every patient pretty well gets the same sort of thing. And you know, they're using supplements and herbs, but is what I prefer. And to be honest, it's a lot of work for me. Sometimes I almost wonder if it's like, boy, do I really want to put in this much work to get a person better? I put a lot of my energy into helping my patients. So we have a nutritional protocol, supplement protocol, but we're very hands-on in our office. And I'm figuring out, every body is like a puzzle that I'm figuring out. One of my mentors said, you got to be like Sherlock Holmes. And he recommended reading those books to help your clinical skill set. And so we're really going through this process of magnetizing our patients, and this is how we do care in our clinic. That's what I recommend to you. I think that's what you're going to get the best results with overall. I think, like I mentioned, I mean, a great acupuncturist will do something similar. A great chiropractor will do something similar. If they're going too much off of X-rays, then that's almost more of a medical model. I've seen some acupuncturists, they have these machines that can measure your acupuncture meridians, which is really cool. But then they have like a protocol. It's like, okay, this is what we're finding from this machine. And so then these are the points we need to do. And there's no feel to it. There's no martial art to that. And I think they probably help a lot of people, and that's how they like to practice medicine. I'm just telling you my opinion about it. So I recommend going to a practitioner who's a martial artist. They make a mastery out of healing, okay? And so there's a lot of different types of practitioners for that. That's what we're doing and offering at our clinic. And so we'd love to work with you if that's the kind of medicine that you're wanting as well.